Good afternoon. My name is Kathleen Hosie. I'm the press officer here at the U.S. Consulate General in Chennai, and I thank you for joining us today for a conversation with 4 journalists from across South India on the topic of reporting on COVID-19 from the front lines. I want to offer a special warm welcome to all the journalism students tuning in today. I understand students from Loyola College, Anna University, Velatech, Manipal University, Mysuru University, Sacred Hearts College Kochi, and many others are tuning in to learn from these 4 journalists on their best practices reporting on COVID-19. Before I introduce our astute panel, I want to say a few words. It's been more than 4.5 months or 136 days since Prime Minister Modi announced a nationwide lockdown imposed to combat the menace of COVID-19 here in India. All across the world, from India, the United States, and elsewhere, all of our lives have changed as a result of this global pandemic. And I want to extend my sincerest condolences to those of you watching who may have lost a loved one from this pandemic, or who are currently suffering physically, emotionally, mentally, as well as economically from the impact of the hardship. Today, we are using this platform offered by the U.S. Consulate General in Chennai, this virtual platform, to connect with 4 journalists who have placed their lives and themselves in harm's way to go onto the front lines to report on COVID-19. Now, media has been described as the 4th pillar of a democracy, and as the world's oldest and largest democracies, the United States and India uphold the values of free expression, free press, and the free and open exchange of ideas. The journalists here today, like their peers all across the world, help citizens, including you and me, to stay informed, especially during a pandemic, in order that we may protect ourselves and our families. Whether you prefer to get your information through print, television, radio, or from your smartphone, we all know there is a lot of information out there, and sometimes it's hard to decipher what is the truth. Here to make sense of that information and help us understand the truth, and here to share their best practices in upholding journalistic integrity, are 4 guest panelists from across South India. I will first introduce them and then invite them to provide an overview, some context from what they're reporting on where they live at this time. Later on in the program, I will invite you, our online audience, to please send us your questions through the Facebook comment box. Our first guest is Sanjib Kumar Roy. He's the editor, owner, publisher of Andaman Sheekha, which is published both in English and in Bangla in the Andaman and Nicobar Islands. He is also the General Secretary of the Andaman and Nicobar Media Federation. Sanjib participated in 2011 in the United States premier exchange program for journalists called the Edward Murrow Fellowship. Thank you, Sanjib. Preethu Nair. She joins us from Kochi, where she is the Deputy Metro Editor at the Times of India. She has extensive experience covering health issues in Kerala, and from the Nipah outbreak to the floods to present-day COVID-19 pandemic. Welcome, Preethu. Chetan Kumar is the Assistant Editor at the Times of India in Bangalore. He specializes in science and technology, space and defense, and now COVID-19. He is a 2019 fellow for the Indo-Pacific Security Studies Program in Hawaii. And finally, last but not least, Aarthi Govindaraman. She's a news correspondent at the Tamil language TV station called Puthiya Thalaimurai. Apologies for my mispronunciation. She has covered political, environmental, and breaking news events, including COVID-19, and she herself is a COVID-19 survivor. Thank you, each of you, for joining us. And at this time, I would like to invite Mr. Sanjib to offer a few words.
Hello to everyone from Andaman Nicobar Island, which is the southernmost part of India. And doing journalism from Andaman Nicobar Island has some good advantage, but many disadvantages also, because we work in an area where internet is almost zero. We depend on satellite broadband for our internet. We are hoping that this August 10, Prime Minister will launch optical fiber cable. After that, journalism will see some good changes over here. Other than that, we also face remoteness because we have 36 different scattered islands, and it's very difficult to collect news from different islands and send newspapers to all the islands. So we overcome all the challenges. We have developed our own SOPs to deal with these problems, and we sort of try out new method of journalism so that we can reach to the remotest part of Andaman Nicobar Island, some part where it takes 3 days to reach by ship. So you can understand the difficulties over here. And moreover, now as I'm talking to you, we are going towards the peak of COVID infection in Andaman. It's going towards the peak now. And we have already recorded 1,027 infection out of 3 lakh population. And 14 deaths already recorded since morning. I have got reports of 2 deaths. So as we are talking, I'm getting input from my WhatsApp, like people are getting infected, people are testing positive, and people are dying. So after this meeting, the first thing I'll do is cross-check all the matters so that I can report it by night. That's all from my side.
Thank you. And again, every death is a tragedy, and my condolences to those victims of this disease. Preethu, joining us from Kochi, can you please say a few words?
Yeah, can you hear me? Hello?
Hear you loud and clear.
Yeah, thank you. I come from Kerala. Now, Kerala has seen an interesting twist and turns because we were the first state in the country wherein the COVID case was detected on Jan 30 with the return of a medical student from Wuhan. Then, we have divided it into 3 phases. That was the first phase when the rest of the country, we were not even talking about COVID. Kerala had seen that. And then we had the second phase wherein, we had these people coming from abroad, Italy and all. They brought in COVID. And then slowly we started seeing a spread. And Modi announced a nationwide lockdown on March 24th. And we are one of the few states which has actually benefited from the lockdown. So, we've seen a growth, then a control, and we got time to manage our COVID infrastructure, manpower, everything. But now we have reached a stage where our COVID cases are increasing, and we are expecting our peak in September, just after Onam. So now we are in a tricky situation, and the government is making every effort to ensure that we are able to control the deaths and we are able to bring down the cases, especially in the coastal areas. Coastal belts of Kerala is becoming a real concern. So this is where it comes. Thank you.
Thank you, Preethu. Chetan Kumar, joining us from Bangalore. Can you say a few words?
Hi, just taking it forward from what Sanjib and Preethu were speaking. COVID couldn't have come at a worse time for India. I'm sure it's the same everywhere else because we already had the economy reeling a bit in the last few quarters of 2019, and COVID has just made it worse, which means that you would see a lot more problems being faced by the marginalized sections of the society. While a lot of us would speak about the pandemic itself and the kind of health hazard it has become and the burden it has put on the medical infrastructure and health workers, I thought I should also make a mention about how COVID, which started out to be a rich man's disease as it was first described, because it was coming by aeroplanes and it was not a virus that originated in India. So people who had access to foreign shores were the ones who were supposed to bring. But if you look at what COVID has done after it reached Indian shores, you would see that daily wage workers, domestic help, people who work as Class D and Class C within the government, those are the people who have been impacted the most. After whom you would see the salaried class, many of whom in the private sector have taken salary cuts, and jobs insecurity has grown. So I think COVID, as we look at it from one perspective, the economic impact that COVID has had is also something I look forward to discussing. Thank you for having me over, Kathleen, and everybody else at the US Consulate.
Thank you, Chetan. And finally, Aarthi Govindaraman, from here in Chennai. Can you please say a few words?
Good afternoon, everyone. I'm Aarthi, and I'm working as a news correspondent in Tamil regional news channel, Puthiya Thalaimurai. So I have been covering like various news. And from March, my major focus is on COVID-19. Tamil Nadu is one of the worst affected in India. Like so far, from as far as yesterday, 28 lakhs they have tested for corona, and 2.73 lakhs people are affected. I mean, tested positive for corona, and so far 4,000 people have been dead due to corona. That's a very sad part, but one happy part, and the one thing which gives hope to us is that nearly 2.14 lakhs people have been recovered so far, which is more than 70% of people are being recovered from COVID-19. So that is one positive thing in Tamil Nadu, and I hope everyone who is affected by corona, like whoever it is, they should have a speedy recovery.
Thank you. So my first question is for any of you, actually. COVID-19 has, again, changed everyone's lives. Most of us are working from home, except for the very vulnerable and exposed daily wage workers that Chetan just referred to. How do you go about your duties and your profession as reporters right now under this current circumstance? How has COVID-19 changed the way you do your work every day?
Can I speak, Kathleen?
Please go ahead, Preethu.
The lively newsroom is missing completely now. So, you know, we used to have a lot of discussion, arguments, a lot of ideas used to come out of it. That's completely missing. So we are on our own. We are searching for stories on our own, except for some phone calls and all. That's the thing. And most of the sources we have to contact over the phone. You know, checking everything ground reality, confirming, reconfirming on the ground is very difficult sometimes, because there's always this risk of infection. But sometimes, of course, we have to go out on the field. We have to get information. We have to confirm that. We have to rely a lot on doctors, the police, because the police are also part of the whole infrastructure. The local panchayats, the local community has been in a big way involved. So yes, but unfortunately, there's so much of stigma attached to COVID. Even now, after so many cases, we have still stigma attached to COVID, that, you know, we have to be extremely careful on the field and ensure that we don't take it to the workplace. Thanks, Kathleen.
Sanjib?
Yeah, from my side, like I would say that in Andaman situations were already tough for journalists, but now after COVID, things have become more difficult because people are trying to work from home, but here internet is pathetic. You cannot work on internet if you're outside broadband area. GPRS doesn't work here more than 2G. 2G is like a dial-up connection speed. We get speed of hardly 54 kbps in 2G. This is the speed we are supposed to work in it. Even a WhatsApp message takes 2 hours to deliver some places. So from remote islands which are 3 days, 2 days away from Port Blair, we have to go by ship. Getting information and getting a photograph is a very big challenge. I tell you, yesterday there was infection in Nikobari tribal group, which is Nicobar district, and it took over 4 or 5 hours to get simple information that how many people are infected. So that kind of situation is here. But what we have done is like we have, as like I have a newspaper, our all office staffs are on leave now. They if they are able to do, they do work from home. But our reporting staffs and our field staffs are on the ground, but they have to go out. But I have restricted them, like if you can take interview over phone call, that's okay. And in case you have to go and meet people, you have to be very careful and use mask and gloves. That's all we can do from here. And now as we are going towards the peak, we are taking more precautions and getting, as Preethu said, that getting correct information has become difficult because over a phone, not many people talk, not many people come for cross check. So getting correct information has become difficult. For them, we have to go out from a room and meet them and get the information. That increases the risk. And if one person get infected in our entire teams become affected. So we are double checking everything, but we can't do compromise with the news. So we have to go ahead with that.
Thank you. Now, Aarthi, if you don't mind, could you please share about your experience? Because as a broadcast journalist reporting from the scene, you have been a victim of COVID-19, and I'm happy to call you a survivor. Can you please tell us a little bit about your experience?
Yeah, sure. When it comes to the health related issues or reporting on health related issues, we need to be extra careful because it directly relates to the people, and we should not create any panic in them. Among the people, we should be very accurate on how you produce the news and how much people are affected, or the data which you give, it should be very accurate. We need to confirm with the officials one or twice, and we should be very accurate about the information which you are providing to the people. But when in the case of corona, it changed everything. Like as a broadcast media person, news correspondent, I couldn't go in person since it was under lockdown, and many officials were scared. They are scared to make us allow, because we are going to many places, so they made sure that they are not convicted or we are safe from our side, contracted of COVID-19. But as days going on, I made sure that I took all the preventive measures. Like I used to sanitize my mobile phones. I used to sanitize everything. I was extra careful since I go to many places. Even though I was so careful, on June 8th, I noticed something that I couldn't smell anything, and I lost my sense of smell and taste. I was zero. I couldn't smell anything. And also I had little cold and cough, so I made sure, okay fine, I isolated myself from my family, and I took a swab test for corona. And the next day the officials called and they said, you have been tested positive for COVID-19. I told my parents, and I made sure they are not scared, because they don't know how to react on it. So I made sure they are not scared. And I also told my husband that, okay, I tested positive for COVID-19. And on the same day, I told my office people, and they made sure that I was under the safe hands. So I went and got admitted to the hospital. I was under treatment for 12 days in the hospital, and I had various issues. Like I had very severe cough. Once I started getting my treatment, I had very severe cough where my lungs used to have severe pain. But then they gave a proper treatment, and on the 9th day after I got admitted, on the 9th day, they took another test. They gave me all the possible treatments, like all the tablets, syrups, proper food, protein-rich food, everything they gave. On the 9th day, they took one more swab test. On the 11th day, I got a result stating that I was negative to COVID-19. I was so happy that I fought corona, and I was tested negative, and I came to my home. I got discharged on the 12th day, and from there I was in quarantine for 14 days. 14 days. After that, I started going back to work. But after the 12th day, as soon as I got discharged from hospital, I started facing certain issues, like it was very hard for me to breathe. I couldn't climb stairs. If I climb stairs, I won't be able to breathe properly. I was having difficulty, and I couldn't sleep properly. But I made sure, okay, fine. You shouldn't be scared. You can overcome. You have to take all the preventive measures. I took whatever doctor advice. I did whatever they said, and I also I also did some workouts and walkings, because it should not affect me more. So I made sure that I should be positive. I shouldn't be scared, because like I have seen many people next to my bed when I was in hospital. They used to suffer a lot. They won't be able to breathe. Many people were in ventilation due to the low level of oxygen. So I made sure, okay, fine. When, the one positive thing which kept me going was the patient who was next to me she was 83 years old. 83 years old, and she was fighting corona. After 5 days, she tested negative. She was very happy. That one thing that kept me pushing. Okay, fine. She has When she has won corona, why can't I? The one thing which I would like to tell everyone is, we need to stay strong. We shouldn't be scared. Okay, fine, I got contracted by corona, but then it is just like a flu. But we need to take extra measures, not like dengue or Nipah or something, but it's just like a flu which comes and goes. But we need to be extra preventive for this COVID-19. So overall, I would like to tell everyone, the positive thing in Tamil Nadu is also that more than 70% of the people are getting recovered each and every day. Every day, the positive cases in Tamil Nadu is recording up to 5,000 each and every day, 5,000 people, and especially in Chennai, there it gradually increased. March last week, in the month of March last week, they recorded 100 people per day, but then it slowly started increasing, like 200, 500, 1,000, 1,500. Nearly 2,000 people got affected in Chennai in a single day. So yesterday also more than 5,000 people got affected all over Tamil Nadu. And at the same time, 6,000 people got discharged who were in treatment. That is one positive note. So everyone can overcome this COVID-19.
Aarthi, thank you for sharing your experience, and for also shedding light on the silver linings of the trends here in Tamil Nadu. But I want to shift to Karnataka, where the numbers are on the increase, and ask Chetan to shed some light on the trends you're observing, as well as the government's response.
Thanks. So that two parts to your question. First, about how the day-to-day working of the media has changed. I think it's largely focusing on one issue for so many days is sort of causing a fatigue. Exploring new angles to report, and the absence of the newsroom, as Preethu was pointing out earlier on, wherein it's so much more difficult now to bounce off ideas or to explore how to package a thing, working along with the graphic section. So those are some of the hands-on problems that media houses may be facing. Getting back to COVID in Karnataka, this is a state that had a slow start, despite Bangalore being a major point of entry into the country. We did not have as many cases almost up to June. So when we ended May with about 3,200 cases and added another 10,000 plus to end June at 15,000 cases. And then at the end of July, as of last night, we have about 150,000 so 150,000 cases. So which means we've added about 136,000 cases just in the last 35 days. So you can imagine how the graph would look. The last 1 month, you would see a vertical line that's going up. And the recoveries, we had a bit of concern up to last week, where the pace of recovery had sort of slowed, which was one of the major reasons, as pointed out by clinicians and also epidemiologists that I was speaking to, is that they found that an increasing number of new cases were progressing to becoming acute patients, which meant that they would take a longer time to recover and not the usual 14 to 21 day cycle that you saw. So a lot of people who got infected in mid-June or end of May are still recovering in the state, which is something that they're trying to address. Overall, the numbers are going up, and just yesterday there was another a happy statistic, as you would say. The number of discharges trumped the number of active cases, although in terms of percentage, they're both around 48%. But the good thing about Karnataka, just like Tamil Nadu, is that our case fatality rate is still under 3%. Although ideally, we should bring it down to 1. But the fact that it's still under 3% is a welcome. So the focus now, I think, would shift to treatment of acute cases, making more beds with oxygens available. That should be the strategy going forward, I suppose. Thanks.
Thank you, Chetan. While we were speaking, we got our first question from our Facebook viewers, from a friend of ours, Vincent D'Souza of Mylapore Times. He asked if each of you could share a story that you worked on that you think had the greatest impact on your viewers. I hope I got that right, Vincent.
Is it connected to COVID-19 or any other coverage?
We'll try to stay on topic. We'll try to stick to COVID-19. And I'll broaden the question, actually. My question is, have you been receiving feedback from your audience? What are they interested in hearing?
Okay, so I'll start, if you can hear me. Yeah, I'll start
Yes.
I'll start with that. Because I belong to Andaman Nicobar Islands, and situation here are different. Here, you need to understand that in Andaman, unmute, yeah. Here you have to understand that in Andaman Nicobar Island, we don't have electronic media playing active role. Actually, we don't exist for electronic media or national electronic media. And reaching newspaper in all the islands is very difficult. So people depend largely on media people through social media to get updates. Any update, they will expect us to send news by social media. So now, in this time when the cases are like going towards the top, towards the peak, and people are getting panic all over the island. Those islands which are isolated are also reporting case from like yesterday and since last 2 days. So this is a very panic situation. We have a population of 350,000, and only Port Blair city, which is the capital, which has around 1.5 lakhs people, out of which if we get 1,000 cases, it's very dangerous. The ratio of per lakh infection is very high here. In fact, yesterday I was going through a graphics. Andaman Nicobar now tops in per lakh infection, which is a very alarming situation here. And considering the fact that we have only 18 ventilators available in Port Blair city. And now, since last few days, we have seen some cases which are reaching hospital, and on the way they are dying, which shows that there is a coordination gap between people, ambulance, and the hospital. That has to be sorted out, because now we are having a fatality rate of 2%, which is which you can say okay, but it has to be like somewhere below 2%. There are people who are dying because of comorbidity, but still the treatment has to be more accurate, and people should get oxygen on the time when they need the oxygen. Because we don't have sufficient bed in COVID care centers, people are isolated in the house. That actually increasing the risk. And because we have very low number of tests over here, because we have only one facility which conduct the test, and that only 300 tests can be conducted here per day. People are waiting. There is a huge queue of people who are waiting for their test to be conducted, and by the time they will be tested, they might infect many others. So this infection is spreading very high. So we are like in the middle of this thing, and we are finding it too difficult to collect all the news, clarify all the news, and put it to public, because lack of resources, lack of internet, and lack of communication.
And just one follow-up, a viewer on Facebook wanted to ask you, Sanjib, how the Sentinel Islands are being affected.
I would like to tell you that Sentinel Island is far from North Andaman Island, and it is totally isolated. People don't go over there, and nobody comes from there. That island is separate since last hundreds of years. So don't worry, no infection has reached there. In fact, we have 6 tribal communities. 4 are primitive. 4 are very primitive. So special cares are being taken so that these 4 communities do not get infected. Although the other 2 communities, among which Nicobaris are most modern, they have got infections since last yesterday. So that is a dangerous thing that we learned since yesterday, that they got infection. But other 5 community, there is no report till now. But we have to be very cautious about this community, especially towards Jarwa, because they live very close to the civil population, and chances are there that they may pick up infection from outsider. That is why entry inside the area was already banned, but there was a road that was also been now closed, so nobody can cross the road. So efforts have been taken so that to make sure that tribals are not infected. I hope I'm clear.
Yes, very clear, loud and clear. Preethu or Aarthi, would you like to comment on my question about audience preferences and audience feedback?
Yeah, people want to hear positive things. They want to hear facts, because there's so much of information on social media. There was so much of information on television. So, they want to know, for confirmation, they want to look at the print media. So what we have to do is we have to analyze the situation. We have to give an in-depth analysis of what is happening on the ground and what can be expected in the few days to come. In the next few days, that's happening. Like I can tell you one thing, like Kerala has been lauded nationally and internationally for its, the Kerala model of COVID control. When the whole world was praising Kerala for its COVID control, we were reporting that it's too early for Kerala to rest on its laurels. COVID, the pattern of COVID is that it comes and hits you. And Kerala, the biggest problem in Kerala is we have nearly 5 lakh people coming from abroad, with many of them losing their jobs. So definitely the people coming from abroad and the people coming from other states, they're coming from COVID infected areas. Also, we have people, our population density is very high. So like even if someone mingles, the infection spreads in the society. 13% of our population is the aged, who are the most vulnerable. Also, we are very high in comorbidities. Kerala is a national capital when it comes to cholesterol, hypertension, and diabetes. So, there are all these concerns. So, for Kerala, we were continuously saying that it's too early. Nationally, they were being praised. Internationally, they were being praised. But we are like, on the ground, please, we need to be alert. We need to ensure that we wear the mask, we maintain social distancing. Government prepares an infrastructure, its manpower. So that was our role as a media. Thanks. That's what I had to say. Anything more you would like to know?
No, we'll switch to Aarthi. She wants to chime in on this question.
So when it comes to the COVID-19 pandemic, it has created a lot of issues among people, like economically. Many issues have been raised among the people, especially it has affected to the people who are doing small scale business and daily wages. So people, they really want to lift up the lockdown for the people who are doing the small scale business and daily wages. They really want to lift up the lockdown because it has affected them very badly, that for everyday survival, it is very difficult for them. And some people, what they say is they need to continue on the lockdown since it is spreading every day. And especially when it comes to Chennai, The other parts of Tamil Nadu people, they are scared to allow the Chennai people to their places because we may be contracted with COVID-19. If we travel from Chennai to some other place, even that people will be affected by COVID-19. They are scared of Chennai people. And the factual thing is many, during this lockdown period, many have vacated Chennai. They have shifted to their natives. And we have personally done many stories, like filed news, that there are a lot of house vacated in Chennai. Not only the migrants who are vacating Chennai, but the people who were in Chennai, who has their house, they left Chennai and they went to their native. So basically everyone are scared. Okay, we don't want to live in Chennai because every day Chennai is recording high in COVID-19, and they make sure they are safe in their native. But now the situation is upside down. Chennai is like becoming down when COVID-19, but other parts of Tamil Nadu is increasing. For example, the next hotspot is Madurai. After to Chennai, the next hotspot is Madurai. People in Madurai are like affected more in coronavirus. So they really are. They really want to leave Chennai, and the people who are doing the daily wages, they lost their job, they lost their houses. Many people are like in COVID care center just because they don't have food to feed for their family. Many don't know what to be done, what survival methods they have to follow. Many are in that situation. So those people, they really want some or the other options to work and lift up this lockdown. So we get all these mixed feedbacks from the people when it comes to this COVID pandemic, because it has affected various people in many issues.
Chetan, would you like to comment on the impact on livelihoods?
Yes, and before that, going back to your earlier question on what readers expect and what we may want to do. See, one of the early distinctions that had to be made or reported was that it was easy to get obsessed with the pandemic per se. And as numbers rose every day initially in March, April, there was a lot of nervousness and panic mode that media also went into, I suppose. But what was important, as I found out much later, our readers appreciated our earlier stories maybe 2 or 3 weeks later, because initially we were trying to report the science part of COVID, which as we found later was very important in communicating how the virus spreads, to stay up to date on what researchers across the world are finding, because COVID, although it belonged to the coronavirus family, the SARS-CoV-2 was a new strain, and researchers didn't have enough, and there was not enough scientific literature. So while people kept reporting that 3,000 more cases, we've hit 1 lakh today, and recoveries are not happening as fast, I thought we were also reporting, and I think that became important in the later days, because it helped policy makers also understand how their isolation policies and treatment should be. There, I think there was a lot of good response, albeit a little slow from the readers. And even now, what they expect is to get a breaking down of numbers, because numbers sometimes can make a situation look very depressing or give you a false euphoria that everything is hunky-dory. So when you say that India has, for instance, this has been spoken about quite a bit in the last week, that India has the least per lakh cases as recoveries go up. But what information is not being given to people is also that India tests the least in 1 per million. We do the least per million tests among the worst hit countries like the US, Brazil, and many others. So as you test lower, your number of positives are likely to be fewer than some of these other countries that are testing positive. But more importantly, I think initially many administrations, like Preethu was pointing out also, felt that their models have worked, and that's the way things should be done on ground, and many others wanted to quickly emulate that if possible. But what they didn't realize is that the spread of virus is not really controllable. Like any flu that history has taught us, once it's there, it is bound to spread. It is bound to peak at a time that it will. But what administrations can do is to prepare enough infrastructure and see if we have enough resources on ground to tackle cases that might need medical intervention, and pump in the dollars to work on vaccines, because until you're able to get a vaccine out, I think the spread of coronavirus per se is not going to be under any administration's control, as much as we want to believe that we are able to control through lockdowns or whatever. Lockdowns, I believe, are like flyovers. Chennai has quite a few of them. It only postpones traffic. Just like a flyover postpones your traffic, a lockdown only postpones the peak time that the virus is likely to spread. But invariably, you have to deal with the spread. And like any other flu or any other pandemic, I think history will judge us based on how many people we lost to this once we emerge out of this pandemic situation, as opposed to how many people were just merely infected. So I think a lot of reporting has to now focus on that, to continuously point it out to the authorities that it is important to put on ground. And COVID has also brought to the fore a lot of other problems that we may have ignored over the years, like basic healthcare centers at various districts and healthcare facilities outside of big metropolitans like Chennai or Bangalore. What happens to the districts when COVID reaches there? Tamil Nadu is getting there. The cases are moving outside of Chennai. In the next few weeks, we'll know how overwhelmed the infrastructure in some of the districts may be. Similarly, Maharashtra is experiencing the same. Karnataka will get there soon. The burden of Bangalore is still pretty high here, but the districts are also seeing a slight increase in the number of cases. So I think that's what the readers would want to know in the future. And we hope that we're up to mark.
Thank you, Chetan. While you were speaking on the same lines of economic impact, we received a specific question for Sanjib from Avantika, who asks, "Sir, tourism is very important in the islands. How are the guides, the boatmen, travel agencies, etc., hotels coping with the lack of tourists? How has the environment been affected? Has it been affected positively as a result?"
I think this is a very valid question. And Andaman's, one of the biggest problem is that tourism is dead after this pandemic. What happened is tourism was the only active industry in Andaman Nicobar Island. And tourism actually runs the Andaman economy. And after this pandemic, the tourism has become completely zero. And once tourism industry becomes zero, you can understand people connected with boat industry, people, guides, the people who are drivers, people who have taken loan for their vehicles and driving vehicles are like suffering the most, because they neither can pay EMI, neither can run their family. Although there is some relaxation from government that you don't have to pay EMI for 6 months, but earning bread has become like very difficult. And most importantly, after repeated demand from Andaman that, can you hear me? Yes. After repeated demand from Andaman that Andaman tourism industry need a separate package for low-level worker connected to the tourism industry, nothing we have obtained, got now. Local society is coming forward to support all the drivers, all the boatmen, but they cannot support for them for 6 months, 7 months, or 8 months. Sometime government has to step in and provide some kind of relief. So the question which you asked, like, is very relevant for now, because thousands and thousands of youths are suffering heavily because tourism industry, because no tourist is coming. Nobody would like to visit at this point of time. All the hotels are closed. Even if you reach, cannot move to other tourist places. All the hotels are, some hotels are like converted into a COVID care center earlier. So no tourist is reaching, no money is flowing. So kind of total lockdown in tourism over here. I spoke to the Chamber of Commerce president recently regarding this issue, and he said that they are waiting for us, although they are happy with government packages, but they are waiting for some kind of relief for tourism industry. But they are hoping that once this pandemic is over, they will bounce back. But I fear that that should not be too long, because we can survive. The people who are the lowest earning people in the tourism industry should not suffer.
Thank you. Preethu, I want to circle back to you. Earlier, you mentioned that people are coming to the Times of India and other newspapers to confirm facts through what they're reading in the print news. Can you start us off on? Can you start us off on a conversation about how you go about verifying information and verifying the facts?
Okay. See, people are relying on the newspapers because there's so much information. There's so much of information available everywhere. So they're relying on something like Times of India, which is known for giving authentic news. So they're relying on that. So it, as a journalist, it's our responsibility to ensure that we give the best authentic information within. See, our timelines have changed. Like earlier, we used to our newspaper used to go to print around 11:30, 12. Now our deadlines, because most of us are working from home, our deadlines are quite early. So we have to give our stories early. So by 6 o'clock, we have to give our story. 6 o'clock, 7 o'clock, our story should come in. So we should reconfirm and everything. So we have to rely a lot on government sources, government health officials, government sources. Then there is Indian Medical Association, doctors. We have to read a lot of literature because this COVID is one thing wherein even doctors are reading and learning a lot of things. So even we have to read and learn a lot of things. So we have to be continuously updated. We have to rely a lot on a lot of medical journals. Like we have to be updated. Like we can't say that we are unaware about things. So that's how we go about it. And if we don't understand, I mean, of course, we are not doctors. We don't understand. We have to talk to a specialist, a pulmonologist, or a critical care specialist, or somebody who is in the medical board dealing with patients. Understand what does the medical literature mean and how do we simplify it so that the common man who is tired and exhausted hearing and reading about COVID understands it and he doesn't feel scared or overburdened and threatened. So that's the whole thing.
Chetan, do you want to chime in here on, if you don't mind, sharing how you vet information, and are you strictly relying on government news bulletins or seeking other sources? And what kind of challenges do you face in this environment for vetting the information?
So there are multiple sources that a reporter will have to rely on. The most primary one would be the government, whether it's the local state government or the union government. Simply because access to all the treatment facilities, the labs that are testing are limited. I don't think most journalists would have access now, largely because of the nature of the environment that we are in today, the fear of contracting the virus, and the government would also want you to stay safe, and thereby access to a lot of labs, which would have otherwise been open maybe, are not there. So you will have to rely on government statistics and government data as and when that is available, which in many states I understand now is a daily affair, but states like Kolkata, I mean like West Bengal, for instance, they give out their daily information at 11:30 p.m. So which means journalists there are one day behind when it comes to getting official data. So I think they will have to rely a lot more on doctors at hospitals and health officials and get data off the record first to be able to make it to the deadlines that they have. But aside from that, more important aspect of covering COVID, like the problem that I had faced particularly was during post-surgical strike that we saw in 2016. There was a similar problem, right? Every time there is something big that happens, social media is flooded with information, some of which coming from very credible sources, most of which are based from other WhatsApp groups, and the source cannot be verified. So half a day sometimes, I'm not exaggerating here, half a day sometimes is lost in trying to vet some of these informations. For instance, we had a video going viral last month about one of the COVID hospitals in Bangalore. It was one of the leading ones which had the maximum number of beds. There was a video doing rounds that people are queuing up outside. They're forced to sleep on pavements because doctors are not letting patients in, which turned out to be completely false. This video was from an earlier time from a completely different state, but it is not something you can ignore. So the trouble that we would have is we would have to spend a good number of hours making tens of calls just to be able to deny a certain information that's doing rounds, to be able to say that it's inaccurate and people shouldn't heed to it. But oftentimes we are a bit too late. By the time we are able to do this, it has reached a lot many people, and I don't know if our corrections and if the fresh information that we are able to put out in public reaches the same number of people as quickly as some of these inaccurate news on WhatsApp especially has been a force multiplier really for fake news.
Do you have any sense of whether what you're seeing is maliciously created false information, what we would call disinformation intended to harm, or if it's just misinformation, which is information that's false but not necessarily created with the intention to harm?
No, we see a bit of both actually, and I'm happy that most of it is misinformation and stemming out of ignorance. But do you also see a consciously designed bit of information campaigning that goes on, sometimes to malign, say, a particular person in charge of some activity that has been entrusted to a particular person. Politics is politics, whether it is within individuals who are not politicians at all. But there are efforts that I have noticed, at least, where some bit of information appears to be consciously designed to malign the establishment sometimes, and sometimes to cause panic, and sometimes simply to peddle someone else. Like there has been a very recent claim on Facebook and other social media platforms in Bangalore that there has a cure has been found by one of these traditional medicine practitioner, who himself has come out and denied it. There were notices served to him, and he's been saying that I never made this claim. But a lot of his medicine that sells over the counter in chemists or druggist stores, I've seen a huge spike in purchase, but the government eventually had to serve notice to him. So I don't know who devised this, because there is enough information out there to say that there has been no cure that's been found so far. But people do peddle these things, some of which appear malicious to me.
Aarthi, do you mind chiming in here and sharing your experience? Perhaps you have encountered, just by being a WhatsApp user, some misinformation or disinformation, and how you make sure before you go on air as a TV broadcast journalist that what you're saying is the truth.
So I'll go with Chetan Kumar. As he said, as a reporter, we rely on many sources. As I said earlier, we need to make sure whatever we are saying is very factual and accurate, because this is something health related issues, and we should not create panic among the people. First of all, the primary source for us is the government officials. We have to wait for the confirmation from a government official, and then we have to officially, report on the news, like what is the current status, how many people have been affected, or many, as Chetan said, we used to get many misinformations, like there are not enough beds in hospitals and people are forced to lie on the pavement, on the floor, and some private hospitals are charging excessively than the actual fare. So we need to cross check with various sources whether this is true, or not, and then once we get the confirmation, we need to report to the people. Since we are I'm working in a broadcast media, we need to make sure that whatever we say is 100% true. Without the proper information or without the proper source with us, we cannot report on the certain issues.
Sanjib, turning to you, could you speak on this topic of how to vet the information, its authenticity, and any of the challenges you might face in the Andamans?
Yeah, I think this is a very, very valid question in these circumstances. And I completely agree with Chetan when he said that WhatsApp is a major force multiplier. I know what happens, in my like what I have seen, people forward message out of fear, out of panic. And there are many people who are like, they want to like the first person to break the news. And out of this friend, they just forward whatever they receive. Sometimes what happens, they cross check with us, they send the news, and then there is a line, is it correct? And if you say it is correct, they forward the first part. Or even if you don't say anything, they forward only the first part, which is rumor, and it spread like wildfire. And it's very, very difficult to control when you spread a false news in WhatsApp, because it multiplies very fast. And then, as Chetan said, like I work in the evening, I need at least 2 to 3 hours to confirm this particular news is correct or not. But by the time the damage is already done, the matter is spread all over internet. And even we put this corrected version, I don't know how much it reaches to the public. So in this point of time, our newspaper has a major responsibility that when they publish news, they must include all these rumors and rectify it, mention it, so that authentic news reach to people. There are many people who forward only authentic news from confirmed news sources or authentic news sources. And if we perform our duty responsibly, I think we can tackle to some extent, although we cannot do it completely, but we can tackle to some extent.
Well, I want to put in a plug at this juncture for a project that the U.S. Consulate General in Chennai has been working on over the past 2 years. And that is in conjunction with the Asian College of Journalism, ACJ. We've been working on an effort to counter disinformation and misinformation, especially in regional languages, by doing a series of workshops with journalists, but also now in the phase of reaching out to journalism schools. And one of the products that we generated through a series of workshops on countering disinformation is this handbook, which I'll show you. It's about 50 pages long, and it's chock full of kind of industry practices, things that you and I could use as smartphone users to check stories, check photos, check videos that our friends or family members may have forwarded us. Anyways, this handbook, which is available in English, Malayalam, Kannada, and Tamil at this time, is available on the U.S. Consulate General Chennai's website, which my colleague will type into the Facebook comments at this time. And we hope that you download the PDF and use this as kind of a pocket guide. We know that technology is rapidly evolving, but there are some very simple tools, even like Google Image, to make sure that what we're getting is we're seeing authentic footage and not something reproduced from a 2014 event, you name it. Shifting gears a little bit, and since we've been speaking, we've received a number of questions on Facebook from students, both from journalism schools as well as public health graduate study programs. So I am sensing a little bit of trepidation from the journalism students who are on the eve of perhaps graduating and entering this profession in the media at an uncertain time. Are there any words of advice or perhaps encouragement that some of you veterans can share with them on this profession and your tips for going forward?
So my tip from my side will be that if you're interested in journalism as a career, you have to make sure that you completely believe in this profession and you can completely dedicate yourself to this profession. I have been covering, this is my second disaster which I'm covering, first being tsunami in 2004. During tsunami, I could not sleep for several nights. We did not get lunch and dinner for many days, like when we went to tsunami hit islands. And now it is COVID. This is another disaster. And if you're not committed in difficult time like this, you will collapse. You're not able to perform. You're not able to do your duty. And journalism, except giving a copy to the desk and reporting the matter to the TV channel or news channel, the responsibility is much, much more. A journalist work like beyond this copy, beyond this TV report. They work 24 hours to cross-check, cross-verify, even with a responsibility that we carry a major responsibility for the society to bring out the truth, bring out the fact, and correct information to the people so that they don't get misguided. This is not just a job, but kind of social service also that we do. So if you're if you're planning to take journalism as a career, make sure that you are completely committed to it. Otherwise, in future, you may face like fatigue or difficulties. And if you love this career, you will never feel like you are fatigued or and you'll just go on and on. So this is the tip from my side.
Anyone else want to comment?
Yeah, Kathleen, I need to add. Journalism, journalism during COVID time has taught me one thing, that you need to be continuously motivated. Self-motivation is a key, because you can't go negative. You can't feel negative. You can't feel down. You're hearing every day about COVID, reading every day about COVID, So you have to be self-motivated. You have to keep yourself positive. At the same time, you have to understand that you are in this profession to spread the correct message, and everything is changed. Like everything around you has completely changed. Now what is happening is, like, you have to ensure that you get your stories a day earlier, because if you want confirmation, your sources may not be available on your phone call. One phone call, you may not reach your source anymore, because everybody is busy, everybody is exhausted, everybody is tired. So if you're planning a story, you have to plan one day earlier. Now we are asked to give exit list every day. Like, exit list is what you plan to do the next day, the stories we plan to do the next day. So we have to be really, really prepared to survive in the field now. You have to be mentally strong and be prepared, committed. That's the only option. There is no other option left now for journalists. Like, you have to work. That's it.
So if I may add, am I audible? Am I audible?
Yes, you're audible. Yes, you're audible.
Yeah, so if I may add, see, notwithstanding what everything else that you may see or hear, the world needs journalists, and it will continue to lead for a very long time to come. So how we present our news and the form in which your viewers or readers consume it may be changing. It has changed significantly in the last decade with the advent of high-speed internet and affordable smartphones and all of that. But the core essence of journalism remains the same. You gather information, you verify it, you verify what you verified, you check one last time before it goes out. So that has to remain the same, and that will remain the same, notwithstanding early deadlines, on-the-go news, and the compulsions to sort of contribute to an ongoing discussion, whether it's domestic or global. I think there is a growing need for journalism students and journalists, in notwithstanding anything else. And one thing that I agree with what Preethu was saying, and also what Sanjib was saying, is that a journalist job is sometimes you do get lonely. So it's up to you to figure out how you're going to stay motivated. It's important that you're able to multitask, pick up new skills, write on as many topics as possible, As much as specialization is something every journalist desires to have, and it is a very important thing on your resume, but to be able to report on, especially on multiple issues that vary in nature. Some could be as interesting as stories about how a city is built, whether it's the workers building your buildings, or those early birds in the morning that clean up your city before you go out to office or school, or some other things like rockets and missiles being fired at each other at the border. So whatever it is, your basic reporting remains the same, and you will have to try and figure out how many different topics you're able to report, which means that yours is more than a 24/7 job. You'll have to keep learning new things. You'll have to keep meeting new people. The more you learn, the less you know. And I think that is the principle with which you'll have to go forward. The asking silly questions is part of our job. You'd rather look silly in front of one of your sources than appear completely stupid after you printed something because you were shy to ask a silly question. So I think self-motivation is important. It can get very lonely, it can get very depressing. But then journalists will be needed for many more years to come, and I think all you guys will make a lot more difference than maybe some of our peers did now.
And I also would like to add a few points that if you're going to become a journalist, prepare yourself for all the situations, because if something major is happening, you need to stay there for a long time. You need to be very strong mentally and physically. But before presenting a news to the people, we always, everyone need to make sure that it is 100% factual. And my editor always used to tell me that read a lot of books, and every day, please make sure that you read at least 2 to 3 newspapers. So through that, you can, and also build up your source and be strong physically and mentally. That is very important.
Aarthi, I'm taking notes. I think your words of wisdom apply to all of us across every profession. Thank you. Now, speaking of another profession, we have a number of viewers, like I said, from public health schools, who I didn't anticipate. So welcome, students. One of the students is from Manipal University, Roshini Banerjee, asks, hi, I'm a public health student. My query is, how is the response of people or other organizations when you approach them while you're collecting information? Maybe you can answer that question, as well as maybe provide some insight on the relationship between the public health sector and professionals and the media.
Can you just repeat the question once again? It was like some kind of audio glitch.
How has the response of people and organizations been when you approach them trying to collect information on COVID-19?
Okay, I'll share experience. It might be different with experience with other, because the organizational setup in other states is different than Andaman and Nicobar Island. In Andaman and Nicobar Island, we don't have an assembly. We run completely by bureaucrats. Bureaucrats appointed by central government, they run Andaman and Nicobar Island. So if they say it is a day, it is a day. If they say it is a night, it is a night. So under these circumstances, the officials, mostly in Andaman, they are afraid to come on the record. There are many sources like health department or any other department. Most of them we contact, they are ready to share information, but they are afraid of quoting names. So most of the time we get sources who are afraid of coming on the record. They can share all the information, but they'll say, don't put my name. Otherwise, superior will get kind of unhappy that why did you quoted that? So when there is a one-man show administration run by one man or one administrator, the lower rank officers, they don't come in front. They don't want to take blame. They don't want to claim anything on the record. So what we do is, for that, sometime if this kind of system is there, sometime possibilities are there that some wrong information comes to us from administration. So what we do is we develop sources in all the department. If any aspiring journalist is listening to this, they must note it down that if you want to become a journalist, always develop sources in the department. These sources are only those people who will cross check, will verify your information which is coming on official way to you. Sources are the one who will intimate you if any major changes are happening. Sources are the one who will cross-check the data provided by the topmost officers. So in Andaman, what we do is we first try to cross-check with the top officers, and then we re-verify with our sources before putting it to public, so that the information is like correct to our knowledge, and we become confident before putting it to paper. And one more thing, in Andaman, there are two kind of like officials, as you say, the relation between the officials and journalists. We have two kind of officers who come to Andaman for 2 years on duty. Their major concern is when we'll go back to Delhi. And officers who are local. So there is a big divide between two kind of officers in administration. Some officers who are not from Andaman, come from mainland, mostly are not bothered much about issues with Andaman. They are only bothered about their tenure and when they'll go back. And there are officers who are from Andaman. So there are disadvantages of that, and there are advantages of that also. But we try to pick up the advantages and make sure that we get right information from administration as well as from our sources.
Would others on the call like to comment on their interactions? Have you faced any resistance from sources on coming on the record and speaking about the pandemic?
Yes.
I'll just add there.
Go ahead, Preethu.
Okay. During Kerala is like every day the chief minister of the state releases the data, he briefs the media. So this is an advantage as well as a disadvantage, because like as the cases are increasing, initially the officials were also very open about things. They were also going to be quoted, but as cases are increasing, there is an unofficial gag order. There is no official gag order, but there is an unofficial gag order. So they are reluctant to talk. They're reluctant to come on record. So this is the moment that any journalism student needs to know that they have to cultivate sources. They have to have sources who trust them and whom they can trust. It works both ways. So mutual trust, mutual communication, continuous communication is very crucial. And you have to get information. You need stories, your authentic stories. Your readers need to know what is happening. So it's your job to get information, and you have to get it. That's the key word. Information is the key word. How you get it is something that you have to develop, and tools are the key for that. Thanks, Kathleen.
Go ahead, Chetan.
Yeah, so one thing that COVID has sort of reiterated is the need for data in the country. While we have been, at least I have been doing a lot of data stories, trying to understand various numbers that are put out through official channels, whether it's education or public health. And COVID sort of reiterates that, because availability of data, real-time data especially, is very limited, which means that you will have to depend on official sources like Preethu was speaking about, or Sanjib was trying to point out. So I always make this distinction, saying that on any given day, you go by the official data, and maybe a few months later, if you're able to dedicate enough resources, you will also be able to get to the authenticity of it. Because a lot of times an event has to occur, we have to pass that time frame, and then you find the time to go back and look into whether the data that was made public at any point was authentic, or were there any mismatches in the claims that were being made by the official establishment. It may not always be the intention for them to hide information. Sometimes because there is a lack of clear-cut understanding of the issue, and also a lack of infrastructure and a lack of resources, results in non-availability of information. It's not resistance as much as inability sometimes. And what we also find is sometimes you do find reluctance, not resistance, from some of the guys who are on the ground. There is a slight reluctance because there is a hierarchy in the bureaucracy, and there is a hierarchy in the way democracy works also, as it was found out very early. Some are always more equal, and not all bureaucrats have been authorized to speak. And but eventually the information does come. Sometimes they're on time. Those are some of the challenges that you find, I think. It's more reluctance than resistance. I don't think they don't want to give it to you, but I think they're a little wary of what may happen if they do.
Well, thank you. We are going to wrap this conversation up, and I would like to invite any of you, maybe beginning with Aarthi, to provide some closing comments.
It is very nice to be present here and talk details about various issues and what are all the challenges as a frontline worker we face. And as a corona survivor, I am like feeling happy to share my experience, like how did I overcome this issue. And I also want the people not to be scared of this COVID-19. It is just like a flu. It comes and it goes, but we need to be extra careful and take preventive measures to make sure that we are not contradicted with this COVID-19. So everyone here, like Shabin, Chetan, and Preethu, Nair, everyone shared their point of view, and it was very, very useful and interactive session. And thank you, Kathleen.
You're welcome. My pleasure. Sanjib, would you like to say a few closing remarks from Andaman Nicobar Islands? We're so happy
Yes,
to have
Kathleen.
you on this call.
Yes, Kathleen, and really it's a pleasure of mine that I'm able to connect with this platform and able to share my views with you. Thank you to every one of you and all the panelists. I must say to everybody who's listening to this program and who have participated in this, that this is a difficult time, and we must take extra care that we have to perform your duty, and we have to safeguard ourselves, and also we have to safeguard our families, because we go out, we may carry infection back home. So this is a difficult time, and we are facing challenges from different society, different places, different directions. People who are watching this program must also understand that in this difficult time, any misinformation can be deadly, can be dangerous. Don't accept, don't consume any information which is not coming from authentic sources. Don't go with forward messages. Always try to consume information from authentic sources. That is the key of key of our safety of everybody. One wrong information can cause disaster. So keep this in mind. And with this time, I'll say goodbye to all of you.
Thank you, Sanjib. Chetan, closing remarks?
I think firstly, I'll thank Kathleen, the US Consulate, and all the panelists for making time to have this wonderful session. I agreeing with both Sanjib and what Aarthi was pointing out. This is a flu, like Aarthi was saying, right? And we have had experience in the past. The human race has overcome multiple such pandemics, and we will overcome this as well. But what COVID has brought to fore, and what we must as a society keep in mind, is about the lack of equity, something that we've always desired as a people. We've always desired to achieve that, but every passing year widens the gulf between the haves and the have-nots. Whether it's voluntary, involuntary, whether it's designed, or if our economies are developing in such a way that this gap has become a byproduct, is for everybody to think. But I think COVID has shown the kind of impact economically any kind of devastating issue could have, whether it's a pandemic or a natural disaster like a tsunami that Sanjib was earlier pointing out to. So the economically backward and the socially backward have suffered and suffered significantly. Just to throw some stats, in Karnataka, we've seen people queuing up for daily ration kits that the government had promised during the first lockdown. Their daily opportunity to earn a livelihood was snatched, and then they were made to stand in queues to get free food, which not many of them appreciated, but had very little choice but to accept it. And similarly, people who've gone out to work, there are problems of employment in many other places. The Asian Development Bank's most latest study, I think they put out a blog yesterday, shows that nearly $100 billion would be lost in remittances across the world, and it would be more than 27% in Asia. Nearly 23, a quarter of the remittances that India was expected to get was not come this year, which means that a lot of families in states like Kerala, in cities like Hyderabad, Mangalore, and Karnataka are bound to be impacted further in the coming months. Sorry. So every crisis teaches us the same lessons, and we sort of very efficiently and very professionally ignore them as soon as we overcome the crisis and we go back to our old ways. I hope that doesn't happen this time, and growth projections and plans become more inclusive in the future, and we take care of one another, because I don't know of any other way that we could grow as a nation or as an economy. Flus, pandemics, they don't distinguish between the rich and the poor, but the effects they have often leave some people more devastated than the rest. I think we'll have to take care of that if there is another problem like this. Thanks.
Thank you, Chetan. And finally, I'm sorry, Aarthi, you want to speak?
Yeah.
Yes.
I'd like to add.
Aarthi, go ahead. What did you want to add?
The one thing I would like to tell everyone who is watching this is, please don't hesitate yourself. Like, many people, what they are doing is, like, if they are having some cough, cold, or fever, they are like scared and they are isolating themselves, and they are not going for the test. So what I would like to tell is, please don't hesitate yourself to go for the test. It is not that scary. Everyone can overcome this. And also, if someone you know is contracted with COVID-19, some of your neighbors or relatives, please don't avoid them, because already, like, this COVID-19, they have to be in isolation for so many days. That mentally depresses the people who are affected with COVID-19. So when someone you know or some of your neighbors or relatives are contracted with COVID-19, please don't avoid them. Be as usual, but maintain social distance and take all the precautionary measures. Together, we can win this COVID-19. So this is the point I would like to add.
Thank you. Over to Preethu.
Yeah. See, there's a growing consensus that, this new normal is not going to change anytime soon. So this new normal is going to be with us for another 1 year, 2 years. Earlier, doctors and scientists used to talk about herd immunity. Now they say that herd immunity is very, very far away. Now we are talking about vaccine, but again, vaccine is not the magic word. I mean, we're just many of the vaccines are in the second phase of testing, some are in the third phase. So it's really, really far away. Like we don't know the effectiveness of the vaccine. We don't know about the side effects of the vaccine. So we have to adjust to the new normal. So, and journalists or future journalists, like especially the journalism students or the public health students, don't be dismayed. Just make the adjustments like we all do. Throughout the world, everybody has adjusted to the new normal. We also have to wear the mask, social distancing, hand wash. That's the key words. And thank you, US counselors. Thank you, Kathleen. And thank you, panelists, for such a wonderful discussion and wonderful time. And hope we all catch up personally during better times.
Here, here. I would love to see you all again in person. Thank you. In a few closing remarks, I want to thank our viewers for tuning in, or perhaps watching this on a recording that will be up on our social media and our YouTube pages. And especially for the students, for your questions and participation. I love Sanjib's quote that you have to love it. Wonderful truth. And I'm glad that I love my job. I love serving here at the U.S. Consulate General in Chennai. I love representing my country, the United States of America, here in India for the past 2.5 years. And I am also signing off on this call. This will be my last virtual program before I leave with my family for the United States this weekend. I want to thank our guests for your professionalism, for sharing your best practices and insights, your candid experiences. And we shared earlier in the program your tweets. We received a lot more questions than I was able to ask you, so I will encourage those students to tweet at you. And appreciate your willingness to participate today, as well as for your bravery for doing what you're doing on the front lines, reporting the truth, informing the citizens of the world's largest democracy about what's going on during this pandemic, keeping them safe and their families. And finally, since it is my final program here at the consulate, I want to appreciate my colleagues who make programs like this program happen, and all other programs, who are working from behind the scenes. There are about 30 of us here in the section, too many to name individually, all of them, but some of the names that come to top mind are Dipti Kumar, who directs our digital engagement, who's supported by Venkatesh, and Sujatha Srinivasan, Nelson Paul, and Hema, whose last name I will not butcher on Facebook Live. Thank you for the wonderful 2.5 past years serving here as your spokesperson, and I will miss you dearly, as well as South India. So, signing out from the consulate. Thank you for joining us.